Welcome to Dialogue on Public Issues. I'm John Channing, host of the show with Campbellsville University. And today we're talking with Jason Bailey, the Executive Director of the Kentucky Center for Economic Progress. Welcome, Jason.
Thank you, John. I'm glad to be here. Appreciate you having me.
I think I said economic progress, economic policy. That is the progress is the goal, of course, of the center. But
is the goal.
Exactly. So I've only made one mistake a minute into the interview. But the Kentucky Center for Economic Policy. Share with us a little bit about your background, just so the viewers get to know you a little bit.
Sure. I've spent all of my career, 20 years now, in kind of the world of independent policy analysis and policy advocacy. So I've had the fortunate opportunity to work for a series of organizations, most recently the Kentucky Center for Economic Policy for nearly the last decade, in sort of looking at the issues that face Kentucky, including Eastern Kentucky. I worked previously for an organization called the Mountain Association, which has been around since the 1970s and is a community development organization that really works on addressing the causes of and the solutions to poverty in Eastern Kentucky. So I've had a unique position of sort of being outside of partisan politics and really just looking at the issues and the underlying trends and conditions and kind of what policy would address that. And I grew up in this region, grew up in Tennessee, in East Tennessee, but moved to Kentucky right after college and have had the fortunate opportunity to call it home for 2 decades now.
Very good. So the Kentucky Center for Economic Policy, the mission is generally to do what? If you could put it succinctly.
Sure. Our mission is to, we're looking to improve the quality of life for all Kentuckians through, and our role in that, is to provide information and analysis around the important public policy issues that are facing the Commonwealth. So we think and believe that the economic conditions that Kentuckians face are very much shaped and determined by the policy decisions, either at the federal level, the state level, or the local level. And it's really important to have a functioning democracy that everyday people, that decision makers have an understanding of the issues at play and how it would affect them, how it would affect their communities and affect their lives. And, a lot of these economic issues are complex, multi-layered. The average person, in the midst of living their lives, doesn't necessarily understand all the ins and outs and implications. And so we see ourselves as kind of filling that role of digesting and analyzing a lot of the issues, and then putting out information that we hope is understandable, clear, and simple, and it helps everybody make better choices.
Do you actually advocate for a particular policy position or simply lay out alternatives for policymakers?
It really, it really depends. We do advocate when we see a need to advocate, and we do draw conclusions. So we aren't just a data farm, that puts out numbers.
Right.
We draw conclusions about what that would mean, and often do advocate to decision makers about what a better course of action would be. We work with in various coalitions. We are actually registered lobbyists, allowing us which allows us to directly speak to decision makers, to legislators on issues. So we do advocate, but we advocate from a position of facts. From what does the data tell us about the impacts, and from the perspective that, as a state, as a Commonwealth, we all do better when we all do better, and it is our position that policy should help lift up the bottom and expand the middle, and that's the sort of the set of values that we bring to it.
In looking at your website, and of course, looking over the last 6 to 8 months, we have all faced the tremendous impact of COVID-19 in the pandemic, the economic impact, the health care implications, and so forth of COVID. Uh, First, the economic impact of COVID, and then the policy response to COVID in Kentucky. What are some of the issues you've been dealing with in that context here in Kentucky?
Yeah. Well, the economy, of course, fell off a cliff when COVID hit, and the impact has been truly massive, and we really haven't had this scale of job loss since the Great Depression, really, and it's actually worse than what we saw in the Great Recession. Uh, One out of every two Kentuckians say that they or someone in their household have lost employment income at this point. So, that is just a tremendous and far-reaching impact on obviously the ability of people to meet their basic needs. It's trickled through and impacted businesses, and it's presented an incredible challenge for state and local governments that have seen revenues fall. It's really been a very quick, much quicker than in the Great Recession, and much deeper loss of jobs. So it's an economic crisis like none that we've faced in our lifetime. And it's one that continues today. We have seen some small bounce back in jobs. We can talk a little bit about why that was in a minute, but we've seen some small bounce back in jobs, but nowhere near to replacing the jobs that we lost. And there's just no indication that we're going to get back to normal or even back to where we were before this hit anytime soon.
Have you looked at all, Jason, at and I know economic impact and economic issues are your primary thrust, but have you looked at the health disparities at all that COVID has revealed to us? Because there are economic implications of that.
Absolutely. We have. And obviously, this is an economic crisis, but first and foremost, it's a health crisis because, we have people, dying every day, unfortunately, both in Kentucky and in the nation. And there's no question that those impacts are disproportionate to certain populations. We're seeing, Black Kentuckians get COVID at higher rates. It's also the case that Black Kentuckians are more likely to be employed as in many of the essential worker jobs. If you look at, for example, certain offices that have had to remain open, childcare, some of those professions that have at least partially remained open are disproportionately made up of women and people of color, and so they have also then therefore been more likely to be exposed to the virus and had to deal with those outcomes. So the whole reason we have an economic crisis, I think we sometimes in the discourse we confuse the actions we've taken to because of the pandemic with causing the economic crisis. It's taking the lives of certain groups of people disproportionately, and we don't know. The truth is we don't know the long-term health consequences of this pandemic yet, and I think the experts are still trying to sort that out.
You mentioned something of an economic, the beginning of some comeback economically. Comment on that, what you are seeing and how you analyze that.
Yeah, I mean, we saw some jobs, the tremendous job loss in March and April that we saw. We saw some jobs come back in May and June, a little bit in July, not as much. But again, they're only a fraction of the jobs that we lost. And it's really important to track and understand why we got some jobs back. The return of jobs, the bounce back of jobs, coincided and began when the federal government the Congress passed the CARES Act, which just sent out a tremendous amount of resources into the economy, into people's pockets. People know about the $1,200 stimulus checks they received. There were $600 a week in supplemental unemployment benefits. There was money to small businesses, money to healthcare, money to states. And the state got about $15 billion, not even counting many of those things. It was reported today by the state budget director. So in a very short period of time, even with all that job loss, a lot of money went out, and the evidence is very clear that people spent that money by and large. They spent it to make ends meet, to pay bills, to make up for the lost employment income. And so when they did that, it helped an economy in very deep straits, very dire straits to bounce back some. And what we're starting, the reason that's really important is because most all of that aid is now gone away. It's expired in recent weeks. And so we're starting to see a softening of consumer spending. We're starting to see that trend back down, and that has very concerning implications moving forward, given that the Congress is at this point in an impasse in terms of passing the next round of aid. And the pandemic is going nowhere. It's not going away. In fact, we're in the midst of this kind of second peak of cases. So we need to understand why we had a little bit of bounce back. It's because a lot of money went out in aid. That aid has now gone away, and so the concern is that we'll have a deeper and longer recession moving forward.
What are the projected impacts that the pandemic and the ongoing budget revenue issues that Kentucky has had for 2 decades together? What is the impact that will have on the state budget in the 2021 fiscal year and then going forward into a new biennium?
Yeah, Kentucky has had budget problems even when the economy was doing well. Right. We were still cutting the budget as recently as last year as we were dealing with challenges there, some of which have to do with the tax code that's got too many holes in it that have been put in over the years. So even going into this, we weren't in great shape. We were 46th among the states in our rainy day fund, how much we'd put aside in a rainy day fund to prepare for a recession like this. We had done very little. And so we were particularly vulnerable when this crisis hit. And of course, what happens when people lose their income, lose their jobs, income tax goes down, sales tax goes down when people spend less. And those two sources make up about 75% of the state revenue that we collect. And other things are impacted as well. People don't play the lottery as much. People don't buy new cars as much. So the revenue loss has been very, very sharp. It's been offset a little bit by the fact, again, we've got all this stimulus money in, the unemployment insurance benefits, which have been very important. We actually tax those as income. So we've been able to collect about $70 million from unemployment benefits that people are receiving for tax receipts. But again, that's the extra $600 that people receive has now vanished. It's gone away. And so that's going to hit the tax receipts. It's happening, the revenue loss is happening at the state and the local level for these governments at the same time that their expenses are going up. We have about 180,000 more people who've qualified for Medicaid as they've lost their jobs and lost income. That's a program that's partially paid for by the state. We have obviously the direct costs of fighting COVID-19, the health departments, the Medicaid program, other things. We're trying to, in various ways, go back to school at a time when people, many people in a situation where many people don't have, access to broadband internet, or the schools are not equipped to socially distance in terms of their physical space. So there's a lot of costs and expense that we're facing. We're seeing childcares shutter all throughout the state as people, have to stay home and aren't paying for childcare anymore. And the subsidy for that is running out. We have a lot of needs on the expense side, and far less revenue on the revenue side, taxes on the revenue side. And so what that means potentially moving forward is we're going to see a second round of layoffs. We've seen all these private sector layoffs as restaurants have closed, as retail has closed. Um, we haven't seen a ton of public sector layoffs yet. But that will be coming if there's not more federal aid. And so when we lay off potentially social workers or teachers or highway workers, um, that's just going to depress the economy further, not to mention cause additional pain and stress for families.
And I might add, our road fund has been in stress for some time,
It
and
has.
that's a whole nother issue we can talk about. And then tell us about the depth of the state unemployment fund deficit.
Well, the state had some money put aside in its unemployment trust fund to prepare for this recession, but no state, was prepared for this recession, obviously,
Right.
because this is deeper and much bigger than anything we've seen before. So, what happens when that fund runs out is the states borrow from the federal government to pay unemployment benefits. They absolutely should and need to do that to help people get by and to, again, stimulate the economy during a recession. Unemployment insurance is very effective and important. But it does leave then, some monies that are owed. And I think that's another place where Congress, should be looking at forgiving these state loans. That would be the ideal thing that would happen, is to see some partial forgiveness so we're not having to deal with that on the other side. Again, this is unprecedented, what we're facing, and those benefits are critical. And it's important that we not on the back end cut benefits moving forward because of this loan. That will just limit our ability to respond to the next recession.
What changes does the center recommend in Kentucky's tax system, both in the short term during this economic downturn, if not depression, and then once we're back at some relative new normal, long term, to restore a healthy business climate and overall productive economy for all of our citizens?
Yeah. Kentucky has an upside down tax system, which means that people at the bottom, people in poverty, people in the middle are paying a much higher share of their income in taxes than are high income Kentuckians, wealthy Kentuckians, and corporations. And we don't think that's a proper way to fund as sustainably the services we all benefit from when we have an economy where much of the economic gains are going to the people at the very top, the people that we're taxing less. And so the most successful states around the country that you see are states that have a more graduated tax system that ask those at the top to chip in for the services that benefit us all. We've been moving in the opposite direction. We've been cutting taxes. At the top, we eliminated the tax on banks a few years ago. Those are things that just make it much harder for us to fund our schools, fund our roads, fund broadband infrastructure, fund healthcare, the things that we know work to build a strong and modern economy. So, there are lots of very specific changes we could make, closing loopholes for corporations. But at the core of it, we need to go back to a graduated tax system. And that's the only way we're going to be able to fund a modern state. And in the short term, I was just going to say, in the short term, that means next session too, we should be looking at changes like that, because the federal government needs to provide us aid. That's first and foremost, but it's likely not going to be enough. And so the state is going to have to chip in as well, just as many states are beginning to do across the country.
Changing the focus slightly for a moment, Kentucky has had a high rate of incarceration compared to other states, among the highest in the nation. And the cost of maintaining that have been escalating at a rather rapid pace over the last decade or so. Now, I know that Governor Beshear has allowed some of those incarcerated to leave imprisonment during the COVID-19 pandemic for health reasons and so forth. But nonetheless, I know the center has opined on reforms and changes that are needed in that incarceration system. From your perspective, what are some of those conditions and changes that may be needed
Yeah,
in our incarceration system?
sure. Well, this is one of the really important issues, and as you say, our rate of incarceration has increased about 700% since the late 1970s, and it's sort of mind-boggling to when you look at some of these numbers. I mean, Kentucky incarcerates people at a rate about 6 times higher than any other advanced country in the world. We have to get those numbers down. And what's happened actually as a country is in the last few years, other states are starting to turn the corner on this, and it's not necessarily even states you would expect. If you look at South Carolina, if you look at Mississippi, if you look at Michigan, they have made some of the changes that are actually bringing down their prison population. We made some small changes in 2010. We've made some small changes since then, but they haven't really they haven't allowed us to begin to move those numbers down. So what are those changes? I would point to a few things on the prison side. I will talk about the prisons and the jails. On the prison side, we have to look at some of our laws around sentencing, where we just are putting away people for too long, for disproportionate to the offenses that they have been charging. That includes drug offenses, includes other small offenses. We can definitely make a difference in that area. Things like technical violations of probation and parole can result in very long sentences that leave us with very high rates of incarceration. The other thing is that we're putting a tremendous number of people behind bars in jails who have not been convicted of any crime. There are people who've been arrested and charged with a crime, but are incarcerated because they cannot afford to post cash bail. And Kentucky's system, and we've produced research on this, is very inequitable, and it's actually just completely inconsistent between counties. Counties right next to each other will have much different rates at which they hold people pretrial. So that's a low-hanging fruit. We have a presumption in this country, in a justice system, that you're innocent until you're proven guilty. But yet we hold people who present no risk to the public, sometimes for very long periods of time, simply because they're poor, and that's just not fair. It doesn't make sense. It's very expensive. It results in people losing their jobs who may be never convicted of anything. Puts tremendous stress on families, etc., and plays a big role in the number of people we have behind bars. So there are things we can do that other states are doing around cash bail and around sentencing laws that would make a big difference.
And I might add, there is some bipartisan interest in reform in that area, if I'm not mistaken.
Absolutely. There's a very good and robust conversation about that. I think counties are feeling the stress of this because they're the ones who have to pay for the jails, even though they're not the ones who decide who goes in there. And so I think there's growing, understanding that we need to do something about that.
The center offers research and analysis in several other areas, and we're down to about 5 minutes, I think, in our interview time. But just very quickly, I wanted to mention 3 of those and just let you hit highlights of some of the primary issues within those. And we've touched on this, but economic security is the first, is a policy area that the center is working on.
Yeah, so this has to do with the fact that we have a lot of people in Kentucky who are poor. We have very high rates of poverty. We also have low wages. So we have lots of people who are working but still living in poverty. So there's a set of policies and changes that can be made that allow people to live and with greater economic security, support their families, and that will lead to greater upward mobility. That includes things like the safety net. I mean, we have to be able to provide people with, enough to eat, children in particular. Yet we have very high rates of food insecurity in Kentucky. So programs like SNAP, the Supplemental Nutrition Assistance Program, are very important and are proven through good research to have long-term effects on the well-being of children as they become adults, if they're able to get basic nutrition. So there's a whole set of policies around that. Kentucky hasn't raised its minimum wage in about a decade. It's the longest period in history since we've had the minimum wage in the 1930s, where we have not increased it. So that affects the quality of jobs that many Kentuckians have, especially as we have more of a service economy. So we need to raise that. We need to allow people to make a living wage for the work that they do. And the more we focus on increasing economic security, the more we can have an economy that is more of a middle class economy that benefits everybody.
The other two areas I wanted to throw out quickly were education and then healthcare.
In education, there's a lot of obviously education issues that are extremely important. Where we focused our efforts is around the financing of education and the affordability of higher education, two issues that are really important. And I'll just say briefly, in terms of K-12, in 1990, Kentucky passed the Kentucky Education Reform Act after the state Supreme Court declared our system of funding public schools unconstitutionally inequitable and inadequate. And we put in place, we raised taxes on corporations, on individuals, and the sales tax to pay for a new system that created greater funding equity. And we have been tracking what's been happening since then. And the reality is, because we haven't updated our tax system and closed those loopholes and made it less upside down, we are returning to the level of inequity between rich and poor school districts that we were in the 1980s when the Supreme Court made that decision. That's very concerning. And if you think about it in the context of COVID, where kids are, having to go to school at home, et cetera, and you think about those poorest school districts having the least resources in a state where in our Constitution we actually say that education is a responsibility, that's a huge concern. That's something we need to address, and we need to address it through the tax system. And then on higher education, we have made a lot of cuts to our state budget over the past couple of decades, and that's hit higher education probably more than anything else. And we know that largely how institutions have responded is through increasing tuition, and that has translated into student debt. And we are concerned about the extent to which student debt and the cost of higher education is deterring people from attending, making it harder to complete higher education, and then saddling them with debt, which impacts their lives in the period thereafter. So there's some big issues around the financing and the affordability of education that are really important as we move forward in the state.
Very quickly, about 30 seconds, any comments on healthcare?
Well, healthcare is an area where Kentucky's been an interesting leader in the sense that, when we expanded Medicaid under the Affordable Care Act, we led the nation in the share of people who gained coverage, and we are seeing real gains as a result. If you look at the deaths from colon cancer, if you look at the treatment that people are getting for chronic conditions like diabetes and hypertension, it's making a big difference. So we have a lot to build on in healthcare. We have a lot to go because we're in an unhealthy state, but at least in terms of coverage, we've made some real progress in the last decade or so.
Jason, thank you very much, and wish you continued success, and look forward to reading the various policy papers coming from the Kentucky Center for Economic Policy, and wish you well, and we'll have you back again in the near future as we continue to discuss the issues facing Kentucky. This is John Chowning with Campbellsville University for Dialogue on Public Issues, thanking our audience for being with us once again. Thank you.